I'm Michelle Collins, certified nurse midwife and professor of nursing at Vanderbilt University School of Nursing. And I'm here to talk about putting in an epidural, or the placement of an epidural anesthetic for the laboring woman. First off, the decision is made that the woman would like an epidural anesthesia placed, or anesthetic placed, and then a consent is discussed with the patient between the anesthesia provider and the patient, and her full permission is given for that procedure. Once the consent is signed and the woman is deemed appropriate for the procedure, then the anesthetic person will position the patient, usually either sitting up on the edge of the bed and leaning over just slightly. We call it sort of an angry cat position with the back poking out just a little bit so that the vertebrae are separated, or lying down on her side in sort of a fetal position, almost hugging the knees, so that again the vertebrae in the back are separated somewhat, so that it's easier to get to where the anesthesia person needs to go. Once they've positioned the woman, it is important for her to stay as still as she can be during the procedure itself, especially during the needle insertion, so that the anesthesia person can be as precise as possible. They will wash off the back first with an antiseptic solution, and they'll put some sterile drapes on the woman's back just to kind of keep the area sterile where they're working in. Then they will inject a little bit of local anesthetic that feels sort of like a bee sting right in the area of the back where they're going to inject the rest of the medication. And for many women, that's the most uncomfortable part of the procedure. After they've put the local anesthetic in, they'll take a different needle called an epidural needle, and they'll go in about 2 inches into what's called the epidural space. And then they will inject medication there, and they'll thread a little tiny catheter, which is a tiny little plastic tube, through the needle, pull the needle back out, and leave just the tiny catheter in place. That tiny catheter is hooked up to a bag of fluid that has medication in it, and a pump would deliver the medication over time through the tiny little catheter into the epidural space so that the woman could have constant anesthesia. It takes around 20 to 50 minutes to put in an epidural, and it takes about 20 to 40 minutes for it to take effect. It is a gradual type of effect. And some anesthesia providers will give the woman a little bit of medication through her IV at the front end of the procedure to help make her more comfortable during the procedure itself.